Question 50. Respiratory regulation of acids and bases involves A. Hydrogen, B. Hydroxide, C. Oxygen, D. Carbon dioxide. Question 50. Answer: D. Carbon dioxide. Question 50. Explanation: respiratory regulation of acid-base balance involves the elimination or retention of carbon dioxide. Question 51. To determine if a patient's respiratory system is functioning, the nurse would assess which of the following parameters: A. Respiratory rate, B. Pulse, C. Arterial blood gas, D. Pulse oximetry. Question 51. Answer: C. Arterial blood gas. Question 51. Explanation: arterial blood gases will indicate CO2 and O2 levels. This is an indication that the respiratory system is functioning. Respiratory rate can reveal data about other systems, such as the brain, making letter C a better choice. Pulse rate is not measure of respiratory status. Pulse oximetry yields oxygen saturation levels, which is not a measure of acid-base balance. Question 52. Which of the following conditions is an equal decrease of extracellular fluid, ECF, solute and water volume? A. Hypotonic FVD, B. Isotonic FVD, C. Hypertonic FVD, D. Isotonic FVE. Question 52. Answer: B. Isotonic FVD. Question 52. Explanation: isotonic FVD involves an equal decrease in solute concentration and water volume. Question 53. When monitoring the daily weight of a patient with fluid volume deficit, FVD, the nurse is aware that fluid loss may be considered when weight loss begins to exceed A. 0.25 pounds, B. 0.50 pounds, C. 1 pound, D. 1 kilogram. Question 53. Answer: B. 0.50 pounds. Question 53. Explanation: weight loss of more than 0.50 pounds is considered to be fluid loss. Question 54. Dietary recommendations for a patient with a hypotonic fluid excess should include A. Decreased sodium intake, B. Increased sodium intake, C. Increased fluid intake, D. Intake of potassium-rich foods. Question 54. Answer: B. Increased sodium intake. Question 54. Explanation: hypotonic fluid volume excess, FVE, involves an increase in water volume without an increase in sodium concentration. Increased sodium intake is part of the management of this condition. Question 55. Osmotic pressure is created through the process of A. Osmosis, B. Diffusion, C. Filtration, D. Capillary dynamics. Question 55. Answer: B. Diffusion. Question 55. Explanation: in diffusion, the solute moves from an area of higher concentration to one of lower concentration, creating osmotic pressure. Osmotic pressure is related to the process of osmosis. Filtration is created by hydrostatic pressure. Capillary dynamics are related to fluid exchange at the intravascular and interstitial levels. Question 56. A rise in arterial pressure causes the baroreceptors and stretch receptors to signal an inhibition of the sympathetic nervous system, resulting in A. Decreased sodium reabsorption, B. Increased sodium reabsorption, C. Decreased urine output, D. Increased urine output. Question 56. Answer: D. Increased urine output. Question 56. Explanation: arterial baroreceptors and stretch receptors help maintain fluid balance by increasing urine output in response to a rise in arterial pressure. Question 57. Normal serum sodium concentration ranges from A. 120 to 125 mg/L, B. 125 to 130 mg/L, C. 136 to 145 mg/L, D. 140 to 148 mg/L. Question 57. Answer: C 136 to 145 mg. L. Question 57 Explanation. Normal serum sodium level ranges from 136 to 145 mg. L. Question 58. When assessing a patient for electrolyte balance, the nurse is aware that etiologies for hyponatremia include A. Water gain, B. Diuretic therapy, C. Diaphoresis, D. All of the following. Question 58 Answer. D. All of the following. Question 58 Explanation. Water gain, diuretic therapy, and diaphoresis are etiologies of hyponatremia. Question 59. Nursing interventions for a patient with hyponatremia include A. Administering hypotonic for fluids, B. Encouraging water intake, C. Restricting fluid intake, D. Restricting sodium intake. Question 59 Answer. C. Restricting fluid intake. Question 59 Explanation. Hyponatremia involves a decreased concentration of sodium in relation to fluid volume, so restricting fluid intake is indicated. Question 60. The nurse would analyze an arterial pH of 7.46 as indicating A. Acidosis, B. Alkalosis, C. Homeostasis, D. Neutrality. Question 60 Answer. B. Alkalosis. Question 60 Explanation. Alkalosis is indicated by a pH above 7.45.